Cryotherapy. Cryosurgery, also known as cryotherapy or cryoablation, is a medical procedure that uses extreme cold temperatures to destroy abnormal or diseased tissues. It is commonly used to treat various conditions, including skin lesions, tumors, and certain types of cancer. During cryosurgery, a cryogenic substance, usually liquid nitrogen or argon gas, is applied to the targeted area using specialized equipment. The extreme cold temperature causes the tissues to freeze, forming ice crystals within the cells. These ice crystals disrupt the cell structure and cause damage, ultimately leading to cell death. The procedure typically involves the following steps. Preparing the patient. The patient is positioned appropriately for the procedure, and local or general anesthesia may be administered depending on the location and extent of the treatment. Application of the cryogen. The cryogen is delivered to the target area using a cryosurgical probe or applicator. The probe is placed in direct contact with the tissue or inserted into the targeted area, such as a tumor or lesion. Freezing and thawing cycles. The cryogen rapidly lowers the temperature of the tissue, freezing it. The freezing cycle is typically maintained for a few minutes to ensure sufficient destruction of the abnormal cells. Then, the tissue is allowed to thaw partially before another freezing cycle may be performed. Multiple freeze-thaw cycles may be carried out during the procedure to maximize the treatment's effectiveness. Monitoring and guidance. Real-time monitoring techniques, such as ultrasound or MRI, may be used to guide the placement of the cryosurgical probe and monitor the freezing process. This helps ensure precise targeting and minimizes damage to healthy surrounding tissues. Tissue removal or absorption. After the freezing cycles, the frozen tissue undergoes a natural process of tissue breakdown, necrosis, and is eventually absorbed by the body or, in some cases, removed surgically. Cryosurgery has several advantages over traditional surgical techniques, including minimally invasive. Cryosurgery is generally less invasive than traditional surgery, as it involves small incisions or no incisions at all. It can be performed on an outpatient basis, reducing the need for hospitalization. Precise targeting. Real-time imaging guidance allows for precise placement of the cryosurgical probe, minimizing damage to healthy tissues. Reduced bleeding and scarring. The extreme cold temperatures used in cryosurgery can cause blood vessels to constrict, reducing bleeding during the procedure. It also results in smaller scars compared to traditional surgery. Shorter recovery time. The recovery time for cryosurgery is often shorter than that of traditional surgery, as it involves minimal tissue damage. Cryosurgery is used to treat various conditions, including skin conditions like warts, actinic keratosis, and certain types of skin cancer, for example, basal cell carcinoma and squamous cell carcinoma. It is also used in the treatment of prostate cancer, liver cancer, lung cancer, and kidney cancer, among others. Advantages of cryotherapy. Pain relief. Cryotherapy can provide temporary pain relief by numbing nerve endings and reducing inflammation. It is commonly used to alleviate muscle pain, joint pain, and chronic pain conditions. Reduced inflammation. The extreme cold temperatures used in cryotherapy can help reduce inflammation in the body. This can be beneficial for conditions such as arthritis, sports injuries, and inflammatory conditions. Muscle recovery. Athletes often use cryotherapy to enhance muscle recovery after intense workouts or competitions. The cold temperatures can help reduce muscle soreness, inflammation, and promote faster healing. Increased metabolism. Exposure to extreme cold may stimulate the body's metabolic rate, leading to increased calorie burning. This can be advantageous for individuals looking to manage their weight or improve their metabolism. Improved mood and well-being. Some individuals report experiencing a sense of euphoria or improved mood after cryotherapy sessions. The release of endorphins and increased circulation can contribute to these positive effects. Disadvantages of cryotherapy. Potential for skin damage. Improper administration or prolonged exposure to extreme cold temperatures can lead to skin damage, including frostbite or skin burns. It is important to follow proper guidelines and ensure the safety of the procedure. Cold intolerance. Cryotherapy may not be suitable for individuals who are sensitive to cold or have conditions such as Raynaud's disease, cold allergies, or poor circulation. Cold intolerance can cause discomfort or complications during the treatment. Lack of long-term research. While cryotherapy has gained popularity and shows promise in certain areas, there is still a need for more comprehensive research to fully understand its long-term effects, potential risks, and efficacy for specific conditions. Cost and accessibility. Cryotherapy sessions can be relatively expensive, especially if multiple sessions are required. Additionally, access to cryotherapy facilities may be limited in certain areas, making it less accessible to some individuals. Individual response and variability. The response to cryotherapy can vary among individuals. Some people may experience significant benefits, while others may not notice substantial effects. It is important to manage expectations and understand that results may vary. As with any medical procedure, cryosurgery carries some risks and potential complications, including pain, swelling, blistering, infection, and damage to nearby structures. The specific risks and benefits depend on the individual case and should be discussed with a healthcare professional who can provide personalized guidance and recommendations.